wellness revolution starts now.
Welcome to the program. My name is Bryana Burken, pharmacist and physician liaison with Physicians Preference Pharmacy. What if I told you that one of the most powerful tools that we have to address cognitive decline, brain fog, and neuroinflammation is something that we compound right here at Physicians Preference Pharmacy? If you've been tuning in for a while, it's definitely not going to be new information as far as what this compounded medication is. But today, the purpose of this episode is to highlight some of the benefits of low-dose naltrexone, which we more affectionately call LDN because it's much easier to say. So we're going to talk about the uses for low-dose naltrexone. And something that I talk about a lot are the repurposed drugs on our drug formulary at Physicians Preference. One of the reasons that this is really crucial to understand of what a drug being repurposed actually means is because we're able to field those questions and help you understand better why the same active ingredient or drug used at a low dose behaves completely differently and does something completely different for your body as it is for the FDA approved or that therapeutic dose. So just because we're using the same active ingredient does not mean that we're trying to address the same set of symptoms at all. I want to make that very clear. So low-dose naltrexone is something that's only available as a compounded medication. Naltrexone and low-dose naltrexone both contain naltrexone. It's just that the compounded version is called LDN because it's made at a significantly lower dose than what is commercially available or the FDA-approved product. So the FDA-approved product is naltrexone. That's something that is made at a much higher dose, around 50 milligrams, and people may take up to 300 milligrams a day. Now, if you've Googled it or looked at naltrexone and you've had a prescription written for LDN, you might say, well, I've never had an issue with drug abuse. I've never been addicted to opioids. We understand. That's why we're using it for a repurposed use. So naltrexone at commercially available therapeutic doses is used to help people wean off of opioids or opioid medications, think painkillers like hydrocodone, oxycodone, fentanyl, morphine, to help them come off of that and not be addicted. The reason that that's important is because it's how the drug works, where it works. LDN is not going to help you be weaned off of opioids, and it does not mean anything that there's been any addiction in the past. I want to make that very clear. Again, we're going to have a conversation today surrounding the opioid receptor, which is central to how LDN works and how it has an impact on improving cognition, brain fog, and neuroinflammation. So LDN is typically compounded in a dosage range of about 0.1 milligrams up to about 4.5. We are seeing people need more and more, especially after the COVID infection, because we're dealing with a different makeup in the body than we were several years ago. So that's something that we want to keep into perspective as well. So one of the most versatile tools for brain fog, the repercussions of long COVID, and neuroinflammation actually sits right here with the use of LDN, which is what we're discussing today. Now, one of the most common questions I seem to be getting is, how can I protect myself from cognitive decline? I have Alzheimer's, dementia in my family. There's some memory issues that I'm noticing are starting to crop up. LDN is not used for prevention. It is used to address one of the root causes of neurocognitive decline, memory decline, and neuroinflammation, which is just simply inflammation in your nervous system or in your nerves, in your brain, in the spinal cord. And so we want to be sure that we're addressing the inflammatory component. Inflammation is key and the root of all disease. And so here's how we can use it in part of an approach to help back down those symptoms related to cognitive decline. So let's first start by understanding how LDN works. This is what we refer to as the mechanism of action. What is the drug doing that allows it to have said benefits in your body? And why do we use LDN for so many uses? If you start Googling LDN, you'll see it's got a long list of applications, over 80 and growing, of different indications that we can use it for. So most importantly, we really want to talk about those opioid receptors, but also how they have a relationship with something called endorphins and enkephalins. Big words, we're going to break it down. So we want to increase the release or production of enkephalins and endorphins, which are certain substances that your body releases on its own. So you've heard of endorphins. It's kind of like the feel-good neurotransmitters that are released, helps you to balance mood. And enkephalins are something that your body makes to help manage pain. Now, when we take something like LDN, it helps to naturally upregulate or increase the production of both of those, both enkephalins and endorphins. Now, there's something in the body called opioid growth factor. And something I really want to drive home with you today is the idea of why we repurpose these drugs and why low dose and high dose is so much different. When we think of the word opioid, sometimes that's a scary word. We have had surgery. We may have known someone that's been addicted to opioids, and they kind of get a bad rep, right? But the reason that many drugs are named as they are is because they bind to a various receptor in the body, and that's actually how they are named. So we have opioid receptors in our body, and that's where these opioid drugs bind. So there's nothing bad about that. We're talking about what an opioid receptor is and what happens when a drug binds to it. There's many things that can happen there. So when LDN binds to these opioid receptors, we have something in the body that is called opioid growth factor. We refer to that as OGF for short. Think of it as your body's own endorphin. So when something binds there, it makes you feel better. It helps to balance the mood, decrease inflammation, and have a more positive impact on the central nervous system. So when I talked about how LDN can be beneficial for so many different uses, another reason why that happens is because this opioid receptor and the production of opioid growth factor, or OGF, is present in many different systems in the body. The central nervous system, the spinal cord, the brain, the small intestines, which is why we can use LDN for inflammatory-driven conditions of the gastrointestinal tract as well. So LDN binds to that receptor, and then it sends a signal to the brain, to the body, to make more enkephalins to control pain and decrease inflammation, and to make more endorphins to help regulate your mood. So you can see how we're tying everything together for the uses of LDN. Now, part of how it works is that we get temporary opioid receptor blockage. So when you take LDN, which is usually taken as an oral capsule, and we're going to talk about the different ways that we offer that, it binds to that receptor and it sits there for about 4 to 6 hours. So it's a temporary blockade. Drugs work to either block that specific receptor or they have some other distant effect throughout the body. Here, it blocks that receptor. And so when it does that, it sends that signal to make more enkephalins, more endorphins to help manage inflammation and help to combat things like brain fog. So how do people notice it? They notice it in terms of improved mood, improved stress resilience, decreased pain, decreased neuropathy, and improvement in neurosignaling. So better memory and neuronal connection function. Now, I'm going to go through a few different uses based on the mechanism of action for LDN of who we actually use this in. First would be neuroinflammation. So what LDN does is it inhibits something called glial cell activation. Now, glial cells, think of that as kind of like the glue between certain neurons that hold it together, but it really does so much more than that. When we activate those glial cells, what happens is that we get cytokine release, which is part of the immune response and inflammatory response, which is necessary, but we don't want that to be turned on chronically. So we get cytokine release. We can also get neurotoxin release, which that doesn't sound good, right? We don't want anything that is going to be creating a toxic burden or a toxic load on your central nervous system. Your central nervous system is your brain and your spinal cord, and then that travels everywhere else throughout the body to the tips of your hands and your toes and all the little nerves and neurons throughout your body as well. Now, if we have that glial cell activation that is not turned off, that's when we really get neuroinflammation, we get brain fog, we get poor cognition, poor memory. I can't remember what I was going to do today. I don't remember why I went in that room. I knew I was going to say something, but I'm having trouble with word recollection. These things can all be roped into one as far as neuroinflammation. Some people actually explain that they feel like their brain is too big for their skull. That is obviously a very exacerbated explanation of what's happening, but the inflammation can be so bad that for some folks, they literally feel that pressure of neuroinflammation. For others on a lower scale, it may just be confusion and brain fog, which is still very serious, but they don't actually physically feel it in the head. The second is one I talk about a lot, mast cell stabilization. So the mast cells are a type of white blood cell or a type of immune cell that are really responsible for asking one question in the body. And it's, am I safe? And you have these little guys that travel throughout the body and are really protecting your temple to try and keep you safe, to try and keep you healthy, to protect you, to keep you alive. And so when they perceive something that seems like a threat, whether that's pollen, so you develop an allergy, whether it's a type of food that you don't tolerate, so you develop an allergy, whether you've had trauma, whether you've had significant bacterial or viral infections, i.e. COVID is a big one, it really ramps up the function of these cells so that they start reacting to everything, because now everything seems like a threat. So before, you seemed like a perfectly healthy individual. Now you can't tolerate the foods, you can't tolerate the sun, you can't tolerate the stress. They all cause overactivation within the body. This is why we cannot forget about the mast cells, because they are so important. So LDN, one of its primary functions is it decreases, stabilizes, or calms down that mast cell activity so that they're not overreacting. Remember, when we talk about something like an allergy, we're talking about an inappropriate response by your body to something that's completely normal. So pet dander allergy, right? Most people can pick up their dog, hug their dog, it's fine, roll around on the floor, sharing the same environment, no issues. And then you have somebody who is highly sensitive. That's considered to be an inappropriate reaction, and part of that is due to those mast cells perceiving a threat. So we can either take them out of the environment and or we can utilize something like LDN to help calm down that mast cell overactivity. Another thing I talk about a lot is histamine. So those mast cells also contain a lot of contents inside, and they're highly reactive with their environment because that's how they keep you safe. They're always surveying their environment in the tissues, in your blood, and in the body. And so part of what they contain is something called histamine. Now, histamine is something that you make naturally that is definitely necessary for life, and it gets released from the mast cell, but in higher quantities when your body thinks that it's being threatened. So think about pollen, right? If you're exposed to too much pollen or a bee sting, something like this, you get the bee sting, you get that welt, you take an antihistamine because you just had a lot of histamine rush to the area to help control the inflammatory response. And so when we use something like an antihistamine, we are backing down that response. So histamine gets released from the mast cells, and it's very important naturally to keep you awake, alert, keep the blood vessels open, help with circulation. But just like anything, when the body overdoes it, it's not going to be beneficial anymore. So we never want to have histamine intolerance, which is another way of saying too much histamine production, too much histamine release, and that's directly related to the functionality of the mast cells. Next up is brain fog, one of the primary concerns and chief complaints that folks come to us here in the Wellness Center to discuss. Now, much of this is oftentimes related to the function or lack of function of the thyroid gland, for sure. It also ties into immunity and inflammation. But we see more and more folks that have general fatigue, brain fog. It could be tied into Lyme disease. It could be post-viral illness. So now we're talking about that as being long COVID, most commonly. The whole goal here is to decrease that neuroinflammation, to take the pressure off the immune system, and to give your brain and your body, your immune system, your thyroid glands, and these vital organs their function back. Long COVID vaccine injury. So some of the symptoms that we're trying to target with the use of LDN in folks that have had multiple COVID infections or perhaps did not respond positively to the COVID vaccine is we're trying to address that cytokine dysregulation. So something that we heard about a lot on the news, social media posts, is cytokine storm. And that can happen for a lot of reasons. But when the immune system is threatened, let's just use the COVID infection as an example. Your immune system is threatened because that virus is hijacking your cells and the metabolism of your cells. You're going to get a mass release of cytokines to try and address the infection and the impact on the immune system. So we need to calm that down. And low-dose naltrexone can help to address that cytokine storm. Also, the neuroinflammation, brain fog is really bad post-COVID and in long COVID for folks. It is one of the longest lasting symptoms that sticks around in long COVID, which long COVID, as a label or a diagnosis or an identification these days, lasts for years. So here we're filming in 2026. We're 6 years out from what we identified as one of the first years that we had COVID infections circulating, and we still have folks that are walking around with prolonged brain fog due to COVID infection. Part of the reason why that sustains is because what drives that brain fog is inflammation, but it's inflammation related to what we just talked about, mast cell overactivation. So those mast cells are highly present in the brain tissue, and when they're being overactivated and threatened, they're causing more and more and more and more inflammation and discomfort for folks. So there was a study that was done by a group called the React 19. React 19, what their focus is looking at folks with COVID infection, vaccine injury, and seeing what actually works. And this is kind of an interesting study because there were 453 participants in this study. And what they looked at was assessing symptom relief. And so they were looking at how well patients responded and what their amount of improvement was on a grading scale, but looking at a lot of different parameters that studies don't usually address: lifestyle, prayer, meditation, supplements, prescription medications, activity, diet. So this took really an evaluation of many different strategies that people could have used. What we actually see based on the results of this study is that when we're talking about prescription medications, LDN, patient reported, LDN improved symptoms more than any other prescription drug that was used for commercially available drugs or compounded medications. And that's even over just a couple that I'll list here that were looked at: ivermectin, benzodiazepines, Zyrtec, B vitamins, melatonin, beta blockers, even vitamin D, vitamin C. There's a long list of vitamins on here, even IV vitamins. So it outperformed all of those according to patients and their perceived improvement, which is, of course, why we're trying to address it in the first place. People primarily noticed increased clarity, so mental clarity, improvement of fatigue, and improvement of overall function, an ability to get back into their daily activities and routine daily living. Lastly, here is addressing chronic inflammation and autoimmune conditions. So these were the primary reasons that we actually ever started using LDN, and that it was recommended. And probably the most common still is I have overall inflammation throughout my body that I just can't kick, or I have an autoimmune condition. Hashimoto's is probably one of the most common things that we use it for because it does work really well on the thyroid. But again, there's never going to be one isolated issue. Maybe you come into us with Hashimoto's and you have an underactive thyroid gland. That's not going to be the only thing going on. There's going to be concurrent fatigue. There's going to be brain fog. It's an autoimmune condition, which means that it's highly rooted in inflammation. And that inflammation is turning around and attacking the thyroid gland, sending it signals that it needs to be in an inflammatory state all the time because something is wrong. So that's why we use something like LDN in conjunction with perhaps thyroid medication or thyroid treatment to optimize your thyroid function, but to take the inflammatory burden off the body so that it can go, okay, everything's fine. I can focus on healing the thyroid gland now. And that's how we use these together so that they work stronger together. And in addition to those that are experiencing chronic inflammation and autoimmunity, there is generally a secondary cognitive benefit because of the reduction of neuroinflammation as well. Let's talk about the timeline for improvement and really what to expect. So low-dose naltrexone is one of those prescriptions that you can't just start and stop it as you feel. You really need to stay consistent with it. You must be compliant with it for a few different reasons. It's something that is designed to be taken over a long period of time. Some people do take it long term. Others take it to get them out of the rut of inflammation while other root cause issues are addressed, and then they can come off of it. But what I want to drive home to you is you don't just take it today and then in 3 days and when you feel like it and when you remember. You start today. You start that titration as the doctor has written that prescription until you get titrated to your intended dose. So what I mean by that is that it's important to give low-dose naltrexone at least a good, consistent 6-month trial before you either say, yes, this is working, or you write it off and say it's not working. You go back to your doctor and we decide something else that's going to work better for you. But you have to give it that trial. The reason why is that we work up slowly in the dosing, which I'll cover here in just a moment. I do want to talk about what patients actually notice. So in the early days to weeks when you start, low-dose naltrexone is always taken on a daily basis. But when you first start it, in the first days to weeks, generally people notice better sleep, improved mood, decreased pain and inflammation, and decreased neuropathy, which is pain in the nerves, tingling, numbness, that sort of thing. For the first months 1 to 3, for example, usually folks notice decreased brain fog, improved focus, task concentration, in addition to decreased fatigue. Fatigue is a big one, and resolution of fatigue is actually something that we see regularly improve for folks who consistently take low-dose naltrexone. What about the long term? So 3 to 6 months and beyond, improved cognitive clarity, again, lifting of that brain fog, and stabilization of the immune system. Now, the immune system also supports cognitive function, and so we want to be sure that we're protecting both of those systems. Now, you may feel worse before you feel better on low-dose naltrexone. This is very much of an individualized conversation between you, the doctor, you, the pharmacist. What if you're not responding like you anticipated? Then what do we do? Sometimes we have to back down the dose. Sometimes we stop the drug completely. But just because you're feeling worse before you feel better is not always a reason to stop. So please hear me when I say that, especially when we're talking about the immune system, because the immune system is like a teeter-totter. And when you get on one side with no friend, it's going to be very lopsided. And so we have to be sure that we bring it back into balance before we make a decision of stopping that drug or if it's right for us. So we have to push it as far as we can go until we've reached immune stabilization. That's very important. Now let's go ahead and wrap up with some dosing and safety measures around low-dose naltrexone. Usually what we most commonly see is low-dose naltrexone is written as a 1.5 milligram capsule. And you get a lot of capsules that first month because you're going to titrate up on your dosing. So generally I see docs write for take 1 capsule by mouth daily for 7 days. Sometimes it's like 10 days, something like that, or somewhere in between. And then every 7 to 10 days, you increase by another capsule. So let's say for the first 10 days, you take 1 capsule. For the next 10 days, you take 2 capsules. For the next 10 days, you take 3 capsules. At the end of 30 days, you're ready for your next refill. And if you tolerate it well, then your doctor can write you a new prescription for that higher dose if you tolerate it. That way you're just taking 1 capsule each day. And it also saves you money because we always want to put money back in your pocket and slim down the regimen where we can. So a couple key points on side effects. The way I was taught, and many docs were taught, is that low-dose naltrexone is more effective if taken at bedtime. We now know that that's not necessarily true. The reason that we were taught this way is because low-dose naltrexone works on those opioid receptors. And it does what that we talked about? It increases endorphin production. You have an all-time high release of endorphins while you're sleeping, which is what makes your dreams vivid. So when folks take it at night, if they do experience vivid dreams, they don't like that because they're having excess endorphin release. So you can always move it to an AM dose if your doc agrees, and that should take those side effects away. Or you could just start taking it in the morning in the very beginning, especially if you're a vivid dreamer, that's usually advisable. Most common dosage form for low-dose naltrexone is capsules. It's also going to be your most cost-effective, but we do have tablets that dissolve under the tongue or it can be applied as a cream. Sometimes that will be appropriate for kiddos as well. Now, naltrexone has a very high safety profile. There are some things that we do want to be sure that we avoid or caution with if you are taking pain medications that are opiate-based, like we opened up this episode with hydrocodone, oxycodone, morphine, fentanyl. Our most common patient population that has that or takes those are our cancer patients, but sometimes it's post-surgery, sometimes there are other things going on. What happens here is if you're taking both at the same time, you technically have an interaction because they both want to bind to that opioid receptor. So who's going to win? LDN's going to win. And so when LDN wins and it binds to that receptor, it kicks off your painkiller and you're no longer going to get the same sort of pain control. And we don't want that. So it doesn't mean that you cannot take them concurrently. It just depends on the dosing schedule, how we rotate them in. And the same advice would go for tramadol. We don't want to be taking those at the same time because it may kick the one off of the receptor, leading to subpar efficacy of your treatment. So in closing, low-dose naltrexone is really used to bring your body back into balance. It helps to address inflammation, take pressure off the immune system. It can help lift brain fog. It can help to improve mood for all the reasons that we discussed. And please remember that the FDA-approved naltrexone does not equal low-dose naltrexone. Not the dose, not the use. It works by increasing endorphin and enkephalin release, and there's a very low risk and high upside to using this for brain fog, autoimmunity, and inflammation. Now, there are several resources if you want to do more digging, which I encourage you to do on low-dose naltrexone. One of those would be the LDN Research Trust, which is actually a charity, but the LDN Research Trust spearheads all of the investigation and the studies that drive the uses for LDN. So if you go to ldnresearchtrust.org, you'll see all the doctor information there, all the patient resources there. You'll see the literature, all the uses, and the rationale and the studies behind everything and all the reasons why we use it. I refer to that all the time. Additionally, you can always visit our website at physicianspreferencerx.com. We have new newsletters there for both patients and prescribers on low-dose naltrexone. Also, YouTube. We have these webinars that are up. We have these podcasts that are up, all where I'm discussing low-dose naltrexone. And we have previous episodes on low-dose naltrexone as well and the other uses for LDN. Lastly, you have us as a resource. So you're always more than welcome to reach out to us at Physicians Preference Pharmacy and discuss with any of our pharmacists at 281-828-9088. And it would certainly be our privilege to serve you. At Physicians Preference Pharmacy, we believe that prescription drugs are commonly overprescribed, treating symptoms only rather than addressing the underlying condition. These drugs offer a temporary fix, but they don't solve the root cause of the problem. Our approach is not about overloading people with medications that offer only a temporary fix. It is so important to recognize that you do not get sick because you have a low level of pharmaceutical drugs in your blood. You get sick because you are deficient in something or because your body is not in balance. As part of your healthcare team, we work with your doctor to restore that healthy balance. Sometimes this means replacing hormones, vitamins, nutrients, or even antioxidants. So how is this different than traditional treatment? Rather than covering up the symptoms with yet another medication, we work to replenish the body, restoring your health and restoring your wellness.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.